Okay. Before you continue, Sister Valerie,
Yes.
perhaps you can go. We are seeing slide 3. Perhaps you may want to go up to slide 2.
Slide 3.
Yes, we are seeing slide 3 right now.
Okay, so I put it back to the first slide. So are you all seeing the first slide? Understanding breast cancer and understanding breast cancer, the topic.
No, I'm just seeing it minimized
Oh,
on this
that's
side.
strange. All right, so let me end on my end and probably try
Oh,
again.
beautiful. That's it. Right. And so if you could click on slideshow to allow us to get the full screen.
Yeah.
Yes. Thank you.
Are you getting it now?
Oh yes, we are seeing it. I mean, it's not on the full screen, but we can see it. Yes, thank
Okay.
you.
All right, so I'm going to the first slide. Are you seeing basic facts about breast cancer?
No, we are still seeing slide 1, understanding breast cancer.
Okay, so probably if I stop sharing and try again. Right? Okay.
Okay, what is it? What is that? Okay, are you ready then?
Right, so I've stopped sharing so that I could try again.
Oh, no, I need to
I don't know what's happening here because it's all open and so on. I can't. Trying again. Yes, Celeste, are you hearing me on the? I don't know what's going on. Okay, just yeah, just Let me just cancel this.
You like him? What? Saeed. Who says? What's he got to do today? Your attention. Everyone gets silent.
And so now is a good time for us if we have any questions or we would like to share a brief testimony as to our experience with cancer, and in particular breast cancer, whether it is a family member or a friend, or even our personal experience. Please you can share in the chat.
The movement of our fluid throughout the temperature. The movement of our fluid through extreme of our temperature gradient. Oh, this as the water gets cold, as the water gets cold water will sink to the bottom of the tank. So we come down here, we put it down. And then we become cold water, cold water expanding, temperature is expanding. And the warmer water will start to flow into the pressure. From cold to hot. Heat transfer by convection from cold water to hot milk. Water flowing to the hot milk.
Good afternoon, everyone. It would be nice if persons who are not speaking or are not having an input in the um, talk today to mute their mics.
The shocks. Oh my God.
Solar panel on sun, it's in capacity. Conductors are transferred. The conductor from one point to the next. The conductor from outside to the inside. So as the tube get hot, the tube change from summer, that is from outside to the inside to the water. If you want to have any water start to slip because I really you want to wait from cold to hot, cold to hot, cold to hot.
So why you wanna become a man? Hey, now why before we get it up?
Okay, Sister Valerie, could you unmute yourself, please?
Wait.
And guests, we're inviting you to mute yourself, please.
Hey, one more water and that's up in the fridge, but why are they always doing that stupidness?
Not sure if they're aware. I think it's Alosia. Could you mute your mic, please? Alosia. I think that's the person name. Mute your mic, please.
All right, are you all hearing me?
Yes, we are hearing you now, sis.
Okay. Right, so I was asking who's at risk for developing breast cancer. And the persons who are at risk are women who have a family history of breast cancer, women who have the breast cancer genes, that's BRCA1 and 2. We'll hear a little bit more about that as we go on. Women who are obese or overweight. Drinking alcohol puts persons at risk for any cancer, including breast cancer. Women who are exposed to estrogen and progesterone hormones for a long period of time, and that's usually persons who would have started the period early, let's say all age 10 or 11, and then they had a late menopause over 60 years, and they had no children, so that at all those years, their bodies have been producing estrogen and progesterone nonstop, right? Especially if they had no children and they never breastfed. So during that time, the estrogen and progesterone levels would be low, and the other hormones would take over. So persons who have not had that experience of having children and they started menopause, they started their period early and had a late menopause, they tend to have been exposed to estrogen and progesterone for a longer period of time than other women. So they are at risk. Just a reminder of the signs and symptoms of breast cancer. A lump, that is the most common sign and symptom. A lump or thickening in the breast, and it's usually not painful at all. So if you have a lump and it is painful, it might be something else other than breast cancer. If you have a discharge or bleeding coming out from the nipple, right? So if it is that you were breastfeeding, you may see sometimes milk draining out and so on. But if you see something like pus or blood, then that is something that you need to look at, have looked at. Changes in size or the shape of the breast. So we know what our breasts look like, right? And therefore, if we see there's a change in not only the size, but um, the shape and so on, then we need to be concerned and we need to get it checked. If we see redness or pitting of the skin over the breast, so the skin would look like the skin of an orange,
All right.
then it is also a sign or symptom that you need to look at, have looked at. Change in color or appearance of the areola area or that area around the nipple. If you see there's a change in color of how it looks, then you need to pay attention and have it looked at. If you have inversion or the nipple sinking in, or you see a dimple, something what looks like a dimple on the skin, all those are signs of breast cancer. So again, these are the signs. A lump. So if you feel a lump, especially if it feels hard like a marble, then you need to certainly check on it. If you see the nipple is pulled in or inverted, if you see skin changes, if you have dripping from the nipple, if you see redness or rash or dimpling in the skin of the breast, it means that you need to check on what's going on. So I just put in some pictures and highlighted some of the areas. So pictures of persons' breasts, so you could see what I'm talking about when we talk about the signs. So you see this red circle area there, there's a lump there, right? Showing that the person has a lump. Sometimes the lump is under the arm, in the armpit, so they need to be checking on those areas as well. So one of the most common early signs is a new lump in the breast or under the arm. And while all the lumps are not cancerous, any new hard or irregular mass should be checked out. Um, think of it as your body's way of tapping you on the shoulder and saying, do not ignore this. You know, sometimes we like to ignore those things that we see and we say it will go away eventually, but this is not to be ignored. Right? Changes in the breast shape or size. Generally, one breast is usually larger than the other. That's normal, and it's usually the dominant side. So the side that if you are right-handed, that is your dominant side. So that breast would usually be a little larger than the other, the left breast. Change in the skin texture. So this sign is called peau d'orange, or it looks like an orange skin. And it could also be associated with inflammatory breast cancer. So you need to pay attention. So again, there are some pictures there showing what it may look like. Dimpling of the breast. You see the dimple, deep dimple there on the side of the breast. Retraction of the nipple is another one. You can actually see the nipple, the arrow pointing to the area, the nipple, and you can see that it is retracted or pulled in. Then if there's any discharge, nipple coming from the nipple other than milk, right? You may see pus coming out or just this watery fluid. That is not normal. So it is something to be checked. Change in the areola. The areola is that area around the nipple. So if you see any changes there, you also need to ensure that you go and get it checked. Right. So I put up here of a picture of what the breast looks like on the outside and on the inside, because we're going to talk a little bit about what happens on the inside when there's cancer. So you're seeing the I'm using trying to use my pointer, right, so that you will see where I'm pointing at. So you see in the areas here, these are lobules, right? So these are the areas that would actually produce the milk if you have a baby and you are breastfeeding. These are the areas where the milk will be produced, and then it will come out through the ducts into the nipple area. All right, and then at the back, of course, you have ligaments, you have muscles, right? So those are the muscles and so on. That is like on the chest wall itself, right? And of course, you have blood
Excuse,
vessels and
the
tail
slide
vessels.
needs to change.
Or you're not seeing the slide? You're not seeing the internal structures?
No, maybe the
Okay, I've
secretary
changed
can
it again.
advise.
I've changed it again. But this one is like a drawing. Are you all seeing this one?
We're on slide 4, signs and symptoms.
Signs and symptoms. All the way back here. Can you see the signs and symptoms? I went back. What slide is showing now?
Same
Signs
one,
and symptoms.
nothing has
Signs and
changed.
symptoms. Okay, so I'm moving. I've moved it. Any change?
No, click on the slide and then see, click it on the slide itself and then
No.
change.
Okay, I'm doing that, and there is no.
Mrs. Tobias,
Yes.
if you look at the top panel to your furthest left, there
Uh-huh.
is
But
from beginning, and then the next one is from current slide. If you
okay,
click
but
on
I
current
am
slide,
just I have my thing open out on the whole slide, so I am not seeing that part at all. I'll have to go back out and the slideshow and go back there.
yes, please.
Okay. Um, all right, I'll see if I'm doing it this way, if that would work. Um, all right, so I'm going to the next slide and let's see if it goes.
We are seeing the change in skin texture slide now.
Okay, so this one is the
Wonderful.
one with the retraction on the nipple.
Yes.
Okay, so that means I'll have to leave it like that to move the slides along.
Okay.
I can't put it on slideshow. All right, so this is showing the changes in the shape of the breast, showing the dimple and the retraction. So those are signs as well. And this one is showing the nipple discharge and the change in the areola. So if the area around suddenly looks like it is irregular or puckering, or you see any kind of change that you're not accustomed seeing, then it is something that you need to have looked at. Right, so this was the slide that I was on, showing the internal structures of the breast. Um, So there is the muscle layer that is closest to the ribs and so on, and then you have the lobules and the ducts and so on inside of the breast. So all these areas are sometimes what are affected by the cancer, right? So you have your blood vessels and so on as well passing all the way along, and pay attention to the fact that you have lymph nodes. So in the other side of the picture, you are actually seeing some dark nodes, and they are the lymph nodes. Important for us to remember that these lymph nodes, the function of the lymph nodes is to drain whatever, if we may have an infection or something, it drains through those lymph nodes. But unfortunately, it is also one of the areas where the cancer cells tend to lodge inside of those areas as well. So when you find a lump, it may be that you are actually feeling a lymph node that has been affected by cancer and cancerous. So people need to be aware that it is not just all around the nipple and so on that you are feeling, but you have to feel under the arm by where the lymph nodes are to see if you have an irregular lump there. Right, so another picture again showing the structure of the breast or mammary glands, as we would know them. And notice again the picture showing the fact that you have these ducts. The ducts are supposed to produce milk, and the milk usually drains out of the nipple. Right? So all of those things are areas that we have to pay close attention to when we are trying to determine if we have any changes that may be cancerous. So these are some of the types of conditions that somebody had a comment. Okay, so I'm moving on. Um, so these are some of the types of breast conditions that women are likely to experience. And I just stopping there, putting a pin to indicate, because some people feel that men don't get breast cancer, right? Because they tell themselves that in the men, most of the time, the area is flat, right? And you may tell yourself that they don't have breasts, but they do have breasts, and men do get breast cancer. So 1% of men may get breast cancer. And some of them, because they don't think that it is breast cancer, they wait until very long before they seek treatment. And some of them do die from breast cancer, right? So you have, these are the types: non-invasive, and these are lobular carcinoma in situ. So you will hear a little bit more. I'll go into more detail in the next couple of slides when we talk about the type, about it being lobular or ductal carcinoma, right? So they have non-invasive and you have invasive. Non-invasive means that it stays in one place and it does not invade other areas like the lymph nodes and so on. And you have as well inflammatory conditions. So somebody could have what is called mastitis, so an inflammation of the breast, and it behaves sometimes just like if it is breast cancer. The breast becomes swollen and painful, and you may find an area feeling lumpy or so. But you see some of the changes. I've seen somebody already, they look like they have the orange skin look. And when they were checked and so on, they did not have breast cancer, but they had an infection, mastitis of the breast. Right? So you could have all those other conditions. Paget's disease is another type of condition of the breast that is not cancer. It is a very bad infection that can eventually become cancerous as well. Right. So these are some more details of the different types of breast cancer. So the invasive breast cancer means that the cancer cells have grown through the lining of the ducts that are inside of the breast into the surrounding tissue. So and it's like an invader. So it has moved now from where the normal structure is, those lymph nodes and so on, and those ducts that have milk coming out of it. They move from those areas and they go into the breast tissue itself, the surrounding breast tissue. Sometimes they go into the muscle. So then it is known as invasive breast cancer. Most invasive breast cancers have no special features and are classed as no special type, NST, or otherwise NOS. So it will be no special type. Sometimes that's what they call it, but they would put on the end of it invasive breast cancer. And between 70 and 80 out of 100 breast cancers are this type of breast cancer, invasive breast cancer. Invasive ductal carcinoma is the most typical type of breast cancer, and it is referred to as IDC. So you would hear, and sometimes, sadly, persons in the health profession or medical profession and so on, they tend to tell the patient, you have so and so, and they would call all the terminology, and they would not explain exactly what's going on with you, the patient. Right? So when they may say, well, you have invasive ductal carcinoma, and you are totally unaware as to what that means, when all it means is that the cancer itself has moved from the tissue and into the ducts that are there, that's usually the milk flows through. So invasive ductal carcinoma starts in the milk duct, where it eventually breaks through the duct walls and it spreads to the other parts of the breast. So it may go to the other organs, it may go to the lymph nodes, it may go and spread to other parts of the body. Because a lot of people who get breast cancer, when it spreads, it may actually reach to the brain, right? So the cells may actually reach to the brain and start another cancer up in the brain. Or it may go down into the bowel, or it may go to the spine, right? So those are the types that are invasive ductal carcinoma. Ductal carcinoma in situ, that's another type. And they shorten it and they put DCIS. So that is an early breast cancer, and it means that some of the cells in the lining of the duct of the breast tissue have started to turn into cancer cells. So they were normal cells and they are now transformed and become cancerous cells. And these cells are all contained within a particular duct, and then they would spread. And as the diagram is showing you there with this blue line, right? So the one in with the duct with the cells just inside, it's localized, meaning it's still in the duct. But the one below, when it's invasive, it has moved from inside the duct to outside in the tissue itself. Right? So they spread. It can spread. Um, Again, diagram is showing you what the normal looks like, the normal milk duct, what it looks like if they have the cancer cells inside, then you see it inside the duct. And when it is invasive and it has spread, it comes outside of the duct and goes into the other parts of the tissue of the breast. Invasive lobar carcinoma now. So that one was the duct itself. When they talk about lobar carcinoma, they're talking about now those the lobules that actually produce the milk. So you have lobules there, and you could see the look of it. It looks like a leaf or a gland, right? So you may have those areas there. They actually have the cells that would produce the milk. So when you have invasive lobar carcinoma, this occurs when the terminal duct lobule units of the breast, they fill with abnormal cells that all look very similar but have lost the ability to stick to each other, right? So they no longer have that ability, and it's called LCIS, also known as lobar neoplasm or in situ lobar neoplasia. So neoplasia just means cancer cell, right? And the lobular has to do with the fact that those are the lobules that are in the breast that actually do the production of the milk. The breast is made up of a series of those branching tubes called the ducts, and they start at the nipple and go backwards. And they end in these small ducts called the terminal duct lobule units. So those terminal duct lobular units is responsible for making the breast milk during pregnancy and so on. And then the milk comes out of that area and through the ducts and then out through the nipple. So that is the area when they talk about having cancer in those areas, it is in those lobules that are supposed to be responsible for producing milk. Lobular carcinoma in situ is not cancer yet, but being diagnosed with LCIS indicates there's an increased risk of developing breast cancer. Okay, so I'm pausing there a little bit for you to take in that. Lobular carcinoma in situ isn't quite yet diagnosed when they check it and they take the cells and they look at it under a microscope. They would not say that it is cancer yet, but it increases the risk of you getting breast cancer. It usually doesn't show up on mammograms, and the condition is more often discovered as a result of a breast biopsy done for another reason. So somebody may have said, well, I feel in a lump and I want to check it. And they go and they take a little sample and they send it off for testing, and they would say, okay, it's not necessarily cancer, but it may start as that, right? Women with LCIS, so somebody's mic is on again, and I don't think they're aware that it's on, right? Right, so women with LCIS or lobular carcinoma in situ have an increased risk of developing invasive breast cancer in either breast. And we'll hear in a little while what is invasive breast cancer. Again, women with LCIS or lobular carcinoma in situ have an increased risk of developing invasive breast cancer in either breast. So even though it may be in that they have LCIS with one breast, it could spread now to the other breast. So if you are diagnosed with LCIS, your doctor may recommend increased breast screening so that you need to check more often than the once a year. And they may ask you to consider medical treatments to reduce your risk of developing invasive breast cancer. So when this is discovered in a woman, instead of them saying, well, okay, come next year for your mammogram or your breast ultrasound, they would check on you like every 3 months or every 6 months to make sure that it has not changed from being this LCIS and change into full blown cancer. LCIS begins when cells in the milk producing gland or the lobule of the breast develops genetic mutations that cause the cells to appear abnormal. So again, there are some pictures there showing the normal and the abnormal. The abnormal cells remain in the lobule and don't extend into or invade the breast tissue. They stay there, the abnormal ones, but eventually they can become cancer cells. So we're going on to look now at the genetic impact on breast cancer. So I'm sure that over time we have heard things like BRCA1 and BRCA2 and HER positive and negative and triple negative. Now those terms are being thrown all over the place when people talk about breast cancer, right? So what are they really? And all of them have to deal with our genetic makeup as men and women, because men do have BRCA1 and 2 as well. Right? So a little bit more about them. I put some pictures there for you all to see what the gene looks like, the BRCA1 and 2. So BRCA1 is found on chromosome 17 and BRCA2 gene is found on chromosome 13, right? And the HER2 positive and HER2 negative, they are found on the outside parts of the cell. Right? So we're going to talk a little bit more about that so that you will be able to understand when you hear those terms, what they mean. So when we talk about our genetic factors, those put us at risk too for developing breast cancer. So about 5 to 10% of breast cancer cases are hereditary. So the person may say, but my mother and my grandmother or my aunt, right? My aunt on my father's side or my aunt on my mother's side had breast cancer. And I look at me, I am getting breast cancer too, right? Or I have been diagnosed with breast cancer too. So you could follow it. You can see sometimes down the family line if you ask somebody. So recently I was doing some screening and so on with persons, and they told me, yes, they didn't have breast cancer, but their aunt had it, and their mother had it, and the other one on the next side had it as well. So they know that they have to be very aware of what's going on with their body. So the BRCA gene mutation, for instance, significantly increases somebody's risk, a woman's risk. Man too, because as I said, those genes also exist in the men. It's essential to be aware of your family's medical history, as this will provide valuable insights into your genetic predisposition. So BRCA1 or breast cancer gene 1 and BRCA2, breast cancer gene 2, are genes that produce proteins that actually help repair damaged DNA. Everyone has two copies of each of these genes. One inherited from the father, one inherited from the mother. So a little bit more about them. BRCA1 and BRCA2 are genes that produce proteins that help repair damaged DNA. Everyone has two copies of each of these genes, one from each parent, as I said. People who inherit a harmful change or mutation or a pathogenic variation of one of those genes have an increased risk of developing several cancers. So, not just breast cancer alone. BRCA1 and 2 are also responsible for persons getting ovarian cancer and sometimes some other types of cancer. So breast cancer, ovarian, right, and other types of cancer. People who have inherited a harmful change in BRCA1 and 2 also tend to develop cancer at younger ages than persons who do not have such a variant. So the person might be in the 20s
Here,
or 30s when they develop breast cancer. How does the BRCA genes work? Nearly everyone who inherits a harmful change
Fire,
in the BRCA1
fire,
or 2 gene from one parent.
fire. Man put on the light in the garage.
So, so somebody still has their mic on and we are hearing about the light in the garage.
Sorry.
Okay, so one person has a normal second copy of the gene inherited from the other parent. So they would have one that may be abnormal and one from the other parent that is normal. So having one normal copy of either gene is enough to protect the cells from becoming cancer. But the normal copy can change or be lost during someone's lifetime, right? So even though you may say, well, okay, I didn't, the cancer didn't come along the line of my father, right? But it came along the line of my mother. So even though you have that one that is good, that other one that is abnormal could still cause a change. So the change is known as a somatic alteration. A cell with a somatic alteration is the only normal copy of one of these genes, doesn't have sufficient DNA, and I highlighted it, doesn't have sufficient DNA repair ability and can become cancerous, right? So that cell alone, if it has issues with that gene itself, that they wouldn't have enough ability because the second one might be normal, but the first one from one of the parents may be abnormal. And that alone could affect the fact that it cannot do repairs and therefore the person can eventually get cancer of they could get breast cancer or any one of the other cancers that we mentioned. How do you reduce your risk for cancer if you have BRCA1 or 2 genes? Now, everybody, as I say, have BRCA1 or 2, but this if that gene is faulty. Individuals who have inherited a harmful change in the BRCA1 or 2 have several options for reducing their cancer risk. These include enhanced screening, so you're screening more often and you're using all the methods of screening. So besides doing self-breast examination, you need to be doing mammograms often, every year, or breast ultrasound, right, every year, and some people even go further by doing some other testing, right? There's some people who would do risk reducing surgery and for breast cancer, that risk reducing surgery involves, and some persons have done it, they have removed both breasts. Right? So I'm sure that you have heard that there's an actress well known, I think it's Angelina Jolie, that would have done bilateral mastectomy just to make sure that she does not get breast cancer. And other persons have done it as well. So, preventative surgery or taking medication to reduce their risk. Generally, it is recommended that women who have inherited the harmful changes of BRCA1 and 2 start breast cancer screening at younger ages. So instead of starting like all 16, and so some persons may say, well, okay, that's not the age to start. The breast is the breast is probably well developed by that age, and they would start to do the little screening and so on, right? But generally, you would say to women that by the time you reach age 20, you start paying attention to doing your screening. So going for your breast ultrasound and going for your mammograms and so on from all age 20, 30, right? So some persons start earlier because they know that they have these damaged BRCA1 and 2 genes. So having screening with MRI or with or without contrast are some of the ways that they would they would look more in depth to see if they have issues with the breast, right? And also they would take a mammogram. What's the difference between, so we talked about BRCA 1 and 2, and now we're looking at another genetic component that we probably hear about as well. And it is the HER2 negative and HER2 positive gene. So what's the difference between HER2 negative and HER2 positive breast cancer? So HER2 positive breast cancer, so some persons when they are diagnosed, the doctor would tell them whether you are HER2 positive or HER2 negative. And they may not explain what that means. So again, this is a genetic component. HER2 positive breast cancer has unusually high levels of a protein called human epidermal growth factor receptor 2. This type of cancer grows and spreads more quickly than HER2 negative breast cancer, but it is not nearly as common. So one is more common than the other. HER2 stands for human epidermal growth factor receptor 2. And the HER2 protein that was discovered in about 1980, and now it's, when they do testing and they try to determine if the people querying and they're saying if they have breast cancer, this is one of the that they would, this is one of the first tests they would do. They would send off to find out. It's not done in Trinidad, it's done abroad. So usually the person's blood has to go abroad for it to be tested. What's the difference between HER2 negative and HER2 positive breast cancer? The proteins, the HER2 proteins are found on the surface of the breast cells and they involve in normal cell growth but can become overexpressed. So they can have more proteins there, as the diagram is showing. You can have more of those HER2 proteins there. And because of that overexpression, it means that a person's level of the proteins are higher than normal. So when they check in, they are looking to see how high those protein levels are. Somebody has on their mic still, and we are hearing you clearly. I hope the child is not dead. HER2 low breast cancer. HER2 low breast cancer is a new classification that applies to cancer in which the HER2 proteins are present, but there aren't enough for the cancer to be considered HER2 positive. Right? So when they check, the levels are low, but they cannot say that the person is HER2 positive. So these cancers have traditionally been classed as HER2 negative. And according to the National Cancer Institute, that's in the US, 50% to 60% is a trusted source of breast cancer for HER2 low breast cancers. So I guess they would be happy when they get this low reading of HER2 negative, HER2 proteins. The HER2 positive breast cancer is rarer than the HER2 negative, but it spreads more quickly due to the excess of HER2 proteins. So those positive proteins, HER2 positive proteins, they can be treated by certain drugs that target the HER2 proteins that are on the cells. But they're not effective for the HER2 negative cancers. So the HER2 low breast cancers are still being studied, but may be treatable from certain other kinds of targeted therapies. Right? So they have a way of, they have some drugs that they can utilize to treat them. So that's why when the woman is diagnosed, that they try to determine if they have HER2 positive higher levels or HER2 negative higher levels. And they would check to see, it would help them to determine what kind of treatment to give, if to give just chemotherapy or if to give them everything, if they hit them with everything, surgery, chemotherapy, radiation therapy. Right? So that helps them to determine how to treat. Then you have triple negative breast cancer. So this is a third one. The RCA, the HER2 positive, HER2 negative, and you also have triple negative breast cancer. What does that mean? Triple negative breast cancer is an aggressive type of invasive breast cancer, and it differs from the other types of invasive cancer in that it tends to grow and spread faster. It has fewer treatment options and tend to have a worse prognosis or worse outlook for the patient. So if the patient is diagnosed and they do the testing and they say you have triple negative breast cancer, then you know that the person is in for a rough time because they will hit them with everything. The term triple negative breast cancer refers to the fact that the cancer cells don't have estrogen or progesterone receptors, and also they don't make any or too much of the protein, the HER2 protein. So the cells test negative on all three tests. So when those patients are diagnosed as triple negative, they have more intense treatment that they have to get. Triple negative breast cancer tends to grow quickly, is more likely to have spread at the time it is found. So by the time they find out and diagnose you as having breast cancer and indicated that it is triple negative, it would have spread already from the breast to other areas in the body. Most times the spread for breast cancer is to the brain, right, or to the spinal cord or the lungs. Um, because of this, the survival rates for triple negative breast cancer are generally not quite as high as they are for the other types of breast cancers. So researchers don't know yet what causes triple negative breast cancer, but they have linked it. They do link this condition to mutations and changes in the BRCA gene. So, however, there are steps that help prevent breast cancer, including the triple negative, and these are the things that we tell women to do all the time. Reach and maintain a weight that is healthy for you. Exercise on a regular basis. Know your family medical history. Monitor your breast health. So it means that you're doing your self breast examinations every month, right? You talk to your healthcare provider about genetic testing for the BRCA genes. If you have a family history of breast cancer, ovarian cancer, pancreatic cancer, or prostate cancer, right? So if you know you have somebody in your family who had one of these cancers, then try to get some genetic testing done, right? So, know your risks, very important. Know your risks. These are all the risks as mentioned, right? So smoking, limit your alcohol, control your weight, avoid radiation therapy. Those things would reduce your risk. Try to keep healthy, right? Eating the right foods, weight loss. Make sure you do once you're over 40, do your yearly mammogram and breast ultrasound. So especially if you know what is your risk, that you have a risk of developing breast cancer or any other type of cancer, right, you make sure that you follow up on your risks. So, right, those again are all the early detection is the next best step. Right? So if you know you are high risk, you have a family history, you had breast cancer before, because some people get it on one breast and then after the treatment and everything go good, they get it on the next breast. Right? If you never had children or you never breastfed, it means that you were exposed to the estrogen and progesterone hormones for a long period of time. You have to do your checks, right? Ensure you do your yearly checks, starting with a clinical breast examination. Some people don't know what is a clinical breast examination, and that is an examination done by a nurse or a doctor, right? Who knows how to examine, to do a clinical breast examination. The other thing is to do an ultrasound and a mammogram, right? And they are fairly accessible in Trinidad and Tobago now, right? Some years ago, they had some free, not free, but some Scotiabank was they were giving out so that you could go and get your mammogram and your ultrasound free. So now it's not free except you get an appointment to do it in the hospital. And in the hospital, they usually have long waiting times, right? Um, this is what a breast ultrasound looks like, right? So that helps to also check and determine if you have any lumps and so on. And as I said, be aware of everything that is going on and what is your health history, what is your family's health history, and so on. Once you are aware of all of those things, then you would be taking the step towards beating breast cancer. So thank you very much for listening to me. Um, and would be pleased to answer any of your questions. So I'm going to stop sharing here. And yeah.
So I want to thank you so much, Sister Valerie Sealey-Tobias, for your thorough coverage of breast cancer, delving into the genetics and letting us know what to do and
Mm-hmm.
why. So, do we have any questions for Mrs. Sealey-Tobias? So, you can now unmute your mics and ask the question, or if you desire, you can place your questions in the chat.
Hi, good evening. I
Good.
have I have a question. What's the difference between an ultrasound, a breast ultrasound, and a mammogram?
Okay, so the mammogram, the machine with the mammogram, it's like two plates, and they put the breast in between there and they press it down so they get the breast almost flat, and they take a picture of it like if they're taking an x-ray, right? The ultrasound, they use what they call a wand on a stick instrument, and they pass it along the breast, right? And they have other kinds of machines as well that they take the ultrasound. What they both of them do is that they are able to see the tissue, the depth of the tissue. So it's like, well, if you do an X-ray, you could see the bones, the skeletal, like so, and so on. But with the ultrasound and the mammogram, right? And the mammogram is specifically for um, the breast, looking at the breast. So when they flatten the breast area, they take a picture. It's like taking an X-ray, right? So they can see the tissue inside, what's happening with the tissue inside. right? And they are available all over Trinidad and Tobago. You can get it either in the hospital or you can get it at other health facilities that you pay for.
Thank you. But do you have a choice in the matter? Can you choose?
Well, 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 most of the times they would start with doing a mammogram, right? And they would add on the ultrasound as well. But both of them give you the depth of looking at the tissue to see what's happening with the tissue inside the breast itself.
Thank you. And there's a question in the chat. What causes a burning sensation in the breast?
Well, it could be um, wondering if the person is talking about in the nipple area or if it is the skin of the breast itself, the so but sometimes anything could cause a burning sensation. You could get a bite from an insect and you could have that burning sensation. If it is a burning sensation in the nipple area, then you have to make sure you check on it and see what is happening. Some persons have an infection, right? Mastitis, and that may also cause that kind of burning sensation. It does not have to be cancer. As a matter of fact, a burning sensation does not fall under one of the signs and symptoms of cancer, breast cancer. So it may be something else.
Thank you so much for confirming that. And so, what is the earliest age that breast cancer can be detected or perhaps has been detected?
In the 20s. I don't think that there's no, at least I have not seen any report of persons in their teens being diagnosed with breast cancer. Usually it is in the 20s, early 20s, late 20s, and beyond.
Okay, so these are the questions in the chat. Yes, someone was going to ask a question, make a comment.
Any ideas of types of exercise suggested as a preventative? No, the purpose of the exercise is to maintain your ideal weight, right? So I'm not going to say that you are going to do hand exercises where you're moving your hand in and out, and that will as I remember as a teenager in secondary school, we used to do that exercise and sing the song, you must increase your breasts. I don't know if some of y'all remember that, but that kind of exercise has nothing to do with helping you with breast cancer. Any other questions?
Good afternoon.
Good afternoon.
I had breast cancer like 32 years ago. I was 28 at the time.
Okay.
I have since had 3 children. I had
Uh-huh.
chemo radiation, I had mammogram, everything.
Okay.
But to do follow-up, I have an issue with the mammogram and the amount of radiation. I prefer to just go straight to do the
To the
ultrasound.
ultrasound. Uh-huh.
Yeah. And that seems to be a problem. They always try, they want you to do the
To the
mammogram first
uh, yeah.
and then the
How
ultrasound.
often do you have to
Is
do
that
your
a hard
follow-up?
and fast rule that you have to follow, or can't I just do any ultrasound? Because I'm very concerned about the radiation aspect.
Yes. I hear you. And it is good that you are concerned because there have been some research done, not in Trinidad and Tobago, but abroad, um, where that same issue, and that is not for persons with breast cancer only, other cancers and so on, because they have to go and do follow up. right? They have to go and do follow-up. And most of the times, the things related to the follow-up has to do with radiation. And so they have found that research has shown that sometimes the effect of the radiation causes you to get a next cancer,
Mm-hmm.
right? So there is research out there speaking about that. Um, so, I mean, I don't want to say to you, well, just do the ultrasound and go along with that, right? Have you expressed your concerns to your doctors when you go for your follow-up?
Well, I go to my GP and I let her know, but we kind of have a thing with that because she wants me to do the mammogram before the ultrasound. But I'm due to go and do it anytime now because I didn't do it last year. Actually,
Uh,
in the past 2 years. So that is the situation there.
so have you tried going back to your where were you? Sorry to ask you this, but where were you treated? Were you treated
I was
privately or
treated at, no, no, I was treated at the St. James Medical Complex.
right?
Yeah.
So
But I normally don't go there, I'm out of like for follow up. It's just like, if there's anything you can just, go back. And I haven't been there in years.
okay,
So I do everything kind of like privately.
yeah. There is a breast clinic at St. James, and I think that they are the doctors who are working in the breast clinic. That's their specialty, and I think that they are very much aware of all the different issues that people will have after
Mm-hmm.
treatment and whatnot, and their concerns. So, I don't know if you want to try going back to
But
that.
will I but I can just call and make an appointment to go in, or do I have to get a referral again or anything? I don't know.
Well, if you have to join the clinic, yes, you
Mm-hmm.
have to get a referral, but you don't have to get you could get it from any doctor.
Oh, okay, no problem.
Yeah, you could get it
Mm.
from any doctor to get a referral. You tell them a history, and you tell them you want to go back and join the breast clinic in St. James, and they would give you that.
Okay, thank you very much.
But I know that doing the mammograms and thing, when I have issues, so I just close my eye and say, Lord, help me here. Yes.
Yeah, because to me, from my recollection, I remember back, I think my dad had tuberculosis when we were pretty young. And I think I can remember being taken down to Wrightson Road. They had that clinic. I remember these real ancient machines, and ever so often you have to go and do these chest x-rays to make sure you don't
Yeah,
have TB. And I don't know, somehow I linked that with the breast
with
cancer.
the mammogram. Oh, with
No,
all
I
you
linked
tell
it with
yourself
the
that
breast cancer, and
having
also
to do
that
those x-rays.
feeling that radiation, that level of radiation, because back then that those machines were really ancient, big, 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 and really, really horrible looking. And I don't know, I have it in the back of my mind that that was the contributor,
Okay.
you know? So
Uh,
that's why I'm very, 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 very
wary.
particular about this. Yeah,
Yeah,
the level of radiation that comes out from these things.
yeah, yeah. But
But
I
thank you
think
very
the
much.
machines the machines are a little bit more modern,
Yeah, they're
so
more
that
modern than no now there, but I remember back then.
yeah.
But thank you very much, and I will look into that, and when I go to my doctor and let her know.
Okay.
Okay, then thank you very much, and very great presentation. A lot of great information. Thank
Thank you.
you.
Wonderful. And we have the concern, expressed again in the chat twice. Does regular mammograms increase your risk, for breast cancer? And additionally, is having a mammogram painful? I heard it is. And
it, it, I would use the word uncomfortable. I would use the word uncomfortable. Some people would
yes,
use the word painful, but I would use the word uncomfortable. Sometimes we have to go through things that are uncomfortable for our own good. You know, yes, and
yes,
women have plenty of those things. So if you have to get a pap smear, it's uncomfortable. If you have to even have an examination and the type of equipment that you have to use, and so it's uncomfortable. But sometimes you have to tell yourself it is for the good, that I will get
mhm,
it. Yeah.
Hello. Good evening, everyone.
Good evening.
Yeah, my name is June Melville.
Yes.
I have a little flu right now, so my voice is, sounding rather strange. Yeah, 2 years ago, I had my usual medical in Trinidad. I live in Tobago, and I had my
Uh-huh.
usual medical, by the Brian Lara place there, kind of
Yes,
place
yes.
where you
Mhm.
do those executive medicals.
Yeah.
And initially, the report from my mammogram was that there was a slight, not a lump, because you couldn't feel it. In fact, my doctor said it was asymptomatic. Yeah.
Uh-huh.
So there was no lump. I had no discomfort whatsoever. But what I did, I'm a former nurse and whatever. And so I decided to follow up.
Mm-hmm.
I decided to follow up. So I made the arrangement at Pembroke Place,
Mm-hmm.
and I had a scanner, an ultrasound.
An ultrasound. Yeah.
And that too was undetermined.
Okay.
So then I went to my GP when I realized, well, okay, the next thing would be a biopsy.
Uh-huh.
And so a few months later, I decided I'm gonna have this biopsy. No one recommended it, but because of my former career in
Yeah.
nursing, I was able to follow up on these. And it so happened that the biopsy said I had cancer.
Uh-huh.
No lump. I
Yeah.
had my usual mammogram. And
Uh-huh.
so to cut the story real short, I had the assistance from various friends in Trinidad, and I ended up at St. James, where they have a real lovely group of doctors and nurses.
Yes.
And I chose, it was recommended that I do a lumpectomy, but I chose to do a mastectomy.
Mastectomy. Uh-huh.
I'm a grandmother, and I don't really need my breast. So I chose that. And it so happened with the histology, it was stage one. Stage
Uh,
one. So I didn't need chemo nor radio.
no radiation because you
Yeah,
caught it early.
that's
Yes.
right. And so I'm just on tabs for the time being, tablets. And
Uh-huh.
so, and of course, I follow up, But what I tend to do, and this is not anything against the system that we have in Tobago, because I've been having my medicals in Trinidad over many years, I
Yes.
still go to Trinidad and have my follow-up, like my mammogram and my scanner.
Yes.
I've decided to transfer my case to Tobago. So it saves me from going to Trinidad, having to stay overnight, hotels, whatever. And so that I can have my just the basic work here in Tobago, the basic follow-up,
Yes.
right? But what I wanted to say, one of my sisters, one of my half sisters, she had both breasts up. She
Uh-huh.
had she had cancer in both breasts,
Both
right?
breasts.
Yes. And then, so one of my other half sister now is saying that she needs to do some special genes testing.
Right.
I'm
So
not sure.
that's the same things like what I was talking about in the thing. So she
Yes.
needs to do some genetic testing. Yes.
Well, I have about three other half, is it three? I don't even know. Three or four other half sisters. So you would recommend that I suggest to them that they should all have the
The genetic testing done.
genetic testing. Okay,
Yes.
because I know they're quite concerned. But it's just that I've been listening, not very long, but I listened to some of the ladies on board who asking if it's painful and
Mhm.
so on. There is a degree
Discomfort.
of pain.
Yes.
Yes, it's discomfort. At the end of the day, it's better to have that small amount of discomfort
Discomfort.
and
Yes.
know where
And
you
know
stand.
what's happening with your body.
Yeah, and then some weeks ago, I remember reading in the Express where Nicole Dyer Griffiths,
Yes. She was
she
diagnosed.
yeah,
Yes.
she was diagnosed with it, and she said, I think she had, her mammogram not long before, within a year, and she recommends that you have both the mammogram
And
and
the
the scan. When you're having your follow-ups. So, I'm just,
Especially if you know what is your history, especially
yes,
if you know you have a family history and so
yes,
on, you need to do everything,
yes.
right? Because as they
I,
say, early, once you catch it early, then you can certainly survive. There are lots of survivors in Trinidad
yes,
and Tobago for breast
yeah.
cancer.
Yeah,
Yes.
I have friends who have had it like 20 odd years, 9 years, whatever. But what I would like in Tobago, I'm not sure if, what how much power or influence you have in Tobago, but I would like to know that more Tobagonians re get rid of this fear and it's like breast cancer. Whoa, it's like the worst thing in the world. It is not the worst thing in the world. I mean, until and unless I told even my church that I had the operation like 3 weeks after I had it, and I look at them and I said, show me which boob it was, and we
And they
must
can,
stand
yes,
up. We must stand up and be advocates
yes,
for
yes. And
breast
I
cancer.
know the unit in Tobago, they have been trying to do yeah, and they do an excellent job, right?
They
So
do.
there's an oncology unit in Tobago. It
Yes.
is the head nurse there is Nurse Frank. I'm calling her
Yes.
name,
I
right?
know.
They do an excellent job. They try very hard. There's a program that is being run in Trinidad and Tobago that deals with networking and reaching persons who not only if that they have cancer, but they may have risk factors, reaching out to them and doing the networking and so on. And I
Yes.
know that they have been doing that. They have been
Right.
doing it in St. James, they have been doing it in Sandy Grande,
Yeah.
all the areas
Uh,
that we have oncology units.
right.
Those nurses have been working extremely hard to
And
really
just
push, and
yeah,
get the information out. Yeah.
yeah, just to add for the ladies who are on board here right now, whoever have influence with be it the politicians and whomever,
Yes, and I'm
I,
seeing some nurses
yeah,
on
we,
the
we we
thing.
need we need to push. I know
I'm seeing Carleen Jack Smart, and I'm
yeah,
seeing
I know Nurse
Jennifer.
Frank and her Nurse Frank and her team are doing a great job up at Scarborough
Yes,
there. But
they
there are
are.
certain limitations. Of course, the place is rather small, and we need some money pumped into that. And in Trinidad, I am in touch with a lady named Michelle O'Keefe. She's an absolutely excellent lady,
Mm,
and she was very helpful. When I had to go to St. James, and she has a wealth of knowledge on breast cancer. So let us not be afraid of talking about it. I tend to tell folks, take my number, call me. If you know anyone who has it, call me, and I will be a spokesperson as best possible.
yes, that's great. That's great.
Thank you so much, Ms. Melville, for sharing your testimony here. And the comment the comment was made that this session was so clear, Mr. Bias, and your delivery was sensitive to how we may feel scared and worried when we feel something is up with our breasts. So thank you for this presentation. But I want to recognize this question, and perhaps we can take just one more as we wrap up. So the question is, if a person has had a cervical cancer, did surgery, radiation therapy, and all other treatments, what
Mhm.
makes it recur with aggression leading to death?
What the return of the cervical cancer?
Yes, yes.
Well, um, it may not be cervical cancer because if they had surgery and so on, they remove the cervix, right? And remove the thing. I had that surgery and we had to remove everything. Okay, so I can't understand if the person's return is that they got cancer somewhere else, and that can happen. That can happen with any cancer, right? So you may have had breast cancer, and you may have had all the treatment and so on. You have had you know you did your surgery and whatever it is, and it may come back and cancer may come back in the brain, right? Because the cancer has a way of hiding. I like to say hiding, but if it gets into those lymph nodes and so on, they hide. It hides, and it can move, right? Metastases, it can move to another area. So it can move to the brain, it can remove. And the thing about it is that it may be lying dormant there for some years. And then next thing you know, there you have it. You have another cancer, and it is another part of the body, right? Because they get into your lymph nodes, those lymphatic vessels, and they travel, right? So it could travel to another area, and another cancer can develop. So I hope that answers the person's question. So that's why we have to be vigilant. We have to be vigilant, and all the different types of testing that we can do, that we can be aware of. We have to be able to use those methods. And one of the things that we are finding now, we are reading about now, is a lot of the things that we use in our household, our everyday things that we use in our household, are carcinogenic, right? So it can cause you to develop another cancer, right? So some of those things that we use every day, some of those things that we eat every day are carcinogenic. So we have to be alert and careful.
Indeed. So, do we have any burning question you will answer or ask? The very last question that we will take this evening. Any last questions? Okay. So, Ms. Sealey-Tobias, if you can perhaps share with us any takeaways that you want us to have coming out of understanding breast cancer.
Okay, so the takeaway I would like to leave with everyone is that whether you are male or female, right? Whether you tell yourself, I'm too old for this or too old for that, right? Or I don't do so and so, I'm not involved in so and so. You have to be aware that cancer is out there. And it's not just breast cancer, right? We celebrating, or we are into October, so we tend to have breast cancer awareness, but there are so many other types of cancers that we can succumb to if we are not vigilant, right? So we have to do our checks. Colorectal cancer is one of the leading cancers in Trinidad and Tobago, right? And so is cervical cancer. Cervical cancer is very high among the young women, because of the HPV, human papilloma virus, right? So, I just want to encourage all of us. We talk to young people, we talk to other persons in our community, and so on. Just remind them that they don't have to suffer from cancer. They can be aware and get themselves tested, all those different areas. And one thing I did not mention, I think I mentioned it earlier, because men feel that when it comes to breast cancer, that does not affect them. But men do get breast cancer, right? 1% of men compared to women get breast cancer, and the two can die from breast cancer, right? But we also have the fact that they have issues with prostate cancer, because it is number four. Trinidad and Tobago is fourth in the Caribbean, right? Fourth highest in the Caribbean for prostate cancer. And we're climbing up very quickly with cervical cancer. So and some of those things are preventable. So I just want to, make sure that everybody can say a word to somebody else about preventing cancer.
Thank you so much for this comprehensive presentation, understanding breast cancer, and then some. So, sharing in a very practical, personal way how we can improve our quality of life through education. Thank you again, Sister Valerie Sealey-Tobias. As we close out this installment of the Upper Healing Platform, the Adventist Health Professionals Association here in Trinidad, I would like to invite Mr. Dave Simon, the president of the Tobago Upper Chapter, to share on what their focus will be for the last Sunday of November, if you're available.
Good evening, everyone. Unfortunately, we have not really zeroed in on this specific topic. We have a couple things in mind, but we have not really zeroed in on the specific topic for next healing platform. As soon as we do, you'll be informed and the link will be shared. All right? But definitely we are on for the last Sunday in the next month.
Okay, so thank you so much, and we look forward to hearing and looking out for that notice for the last Sunday of the new month, November, where we meet. That is the Adventist Health Professionals Association, Trinidad, as well as Tobago chapters. We meet every last Sunday of the month, sharing information, promoting good health, and helping our communities recognize that we can make healthy choices easier choices. So, do have a pleasant evening, and let's close out with prayer. Dear Father in heaven, thank you so much for each person that was present here this evening. Thank you for presenter for having her share these concepts so clearly, simply, and really motivating us to action. In a special way, we ask you to continue to provide for those, all of us, as we face different health challenges and even that of cancer. Give us the courage that we need, holding on to you to meet our every concern. In Jesus' name, amen. Do have a fantastic week ahead, and here's wishing you great health in Jesus' name. God bless you.
Thank